Very good morning, guys. It's a fresh morning. So, welcome to our session, Psychiatry, Inicet topics. Guys, some of the doctors are asking me about pharma. Guys, don't worry. Please don't worry. I am here to finish each and every subject. I am saying once again, please don't worry, okay? I will finish as fast as I can, and trust me, I have given you the word that will finish 2 revisions before the examinations. Okay, 2 revisions before the examination. So don't feel tensed. Okay, I'm here to finish this. So let's start. Okay, so today's topic is which some of the doctors are asking me about. Sir, please discuss information regarding extrapyramidal effects, EP symptoms in psychiatry. Fine. So we'll discuss some of the extrapyramidal side effects and the treatment that you should follow on with it. Right. First, we will just take the dopaminergic pathways. We'll check the. So, if it's in case of a mesocortical, then it will be showing negative symptoms, right? But if it is in mesolimbic, then it goes on with positive symptoms. If not with tuberoinfundibular, it's tuberoinfundibular, right? Then there will be, it regulates prolactin levels. Nigrostriatal, can you tell me any condition which relates with nigrostriatal pathway? Anyone? Right? Anyone? So you just drop it down in the comment section. Some of the conditions deal with nigrostriatal pathway, some of the pathological conditions, you please drop it down in the comment section. Okay? Extrapyramidal symptoms. So these are the so and so dopaminergic pathways that execute this so and so conditions. You take mesocortical with negative symptoms, mesolimbic positive symptoms, tuberoinfundibular, it regulates the prolactin levels, right? And nigrostriatal differs the extrapyramidal symptoms. Okay, now we will discuss something about acute extrapyramidal symptoms. Okay, acute extrapyramidal symptoms. One of it is akathisia. It is the most common extrapyramidal symptom, and it occurs within 1 to 2 weeks of antipsychotic exposure. Guys, listen each and every statement, because each and every statement is an MCQ. Don't delay. Okay, you just listen carefully. Don't just get out of the track. Okay, so it occurs within 1 to 2 weeks of antipsychotic exposure, and there will be a inner restlessness. There will be observation of inner restlessness regarding the patient. Now we can also observe lower limb movements, right? So what is the drug of choice for this condition? It's very simple. Remember, it's propranolol. That is all about akathisia. Okay, so what happens is, it's the most common extrapyramidal symptom. Just remember this, I am keeping a star. It's the most common extrapyramidal symptom, and it occurs within 1 to 2 weeks. Always check the MCQ. If there is any history or if there is any timeline is been written, you just check it. Always psychiatry deals with timeline. You take anything, Alzheimer's, Parkinson's disease, bipolar disorders, everything deals with timelines. Okay, so you check the timelines in the MCQ, that's for sure. Okay, so it occurs within 1 to 2 weeks of antipsychotic exposure. Now there will be inner restlessness as well as lower limb movements. Now what is the drug of choice? It's simple, propranolol. That's it. Okay, now if you go for one more condition called acute dystonia, right? So what sort of things we observe in acute dystonia? There will be oculogyric crisis. Oculogyric crisis, this can occur. Oculogyric crisis can occur. Now what will be the treatment of acute dystonia? Simple, you just inject injectable anticholinergics. Or you can also give antihistaminics also, no problem. Can anyone tell some of the antihistaminics? Pharmacology. Loratadine, desloratadine, promethazine, these all are antihistaminics only. Okay. Now we will discuss about chronic EPS, chronic extrapyramidal symptoms. Right. What you observe in this condition is there will be tardive dyskinesia, and dystonia. Tardive dyskinesia and dystonia. Now what treatment you will give for chronic extrapyramidal side effects? If it is chronic, simply you give some class of drugs called VMAT2, vesicular monoaminase transporter, right? 2 inhibitors, VMAT2 inhibitors. In pharmacology, this VMAT2 inhibitors are very important MCQs. So VMAT2 inhibitors, which are valbenazine, then tetrabenazine and deuterabenazine. Okay. Now we will discuss something about lethal extrapyramidal side effects, lethal EPS. Okay. Now what you denote is acute laryngeal dystonia. Acute laryngeal dystonia or neuromalignant syndrome, also called neuromalignant syndrome. So you will observe a triad of symptoms. What is the triad? You see fever, delirium, you observe fever, delirium and lead pipe rigidity. Lead pipe rigidity. So lead pipe rigidity is observed in where? Acute, chronic or lethal? Lethal. In lethal extrapyramidal symptoms you observe lead pipe rigidity. I think this is an MCQ asked in Neet 2020, I think. Yes. Now what tests or investigations you observe here, there will be an increased WBC, and also there will be an increased CPK, and there will be also observing of myoglobinuria. What is myoglobin? Hemoglobin present in the muscle is called myoglobin. Okay, so what myoglobinuria mostly suggests, if there is occurrence of myoglobinuria, then it suggests there is a renal failure. You understand? There will be a renal failure. Now, neuromalignant syndrome, what is the drug of choice? Everybody knows here what it is. It's dantrolene sodium. It's the drug of choice in case of neuromalignant syndrome. Okay. Now, do we have any other treatment options? Yes, we have some other treatment if you really want to give. That is bromocriptine. What is bromocriptine? For which condition bromocriptine is used? Can anyone tell? It is a anti-galactopoietic hormone. So it can be given in prolactinoma. That is not large tumors, prolactinomas, not for large tumors, but for smaller tumors which can be normalized with the help of a drug. In that conditions you can give bromocriptine, right? Now, what are other drugs that you can give? Amantadine, and also you can give electroconvulsive therapy. Bromocriptine is used for prolactinoma. I will write here. So many doctors are asking. It's a anti-galactopoietic hormone. Can you tell me on which receptor bromocriptine acts? Acts on D2 receptor. Okay. Finish. I think we finish the condition. Okay. So with that, that's all about extrapyramidal symptoms. So we'll meet on with a new topic. Thank you. Your wise doctor.